I'll begin in 3, 2, 1. Bismillahirrahmanirrahim. Assalamu alaikum. Greetings to the respected chief guests, to members of the audience. I am Mohammed Ali, proposition leader of the House today. And the motion that I'm here to support is that this House believes that the patients of mental health disorders, of suicide attempts, and of drug abuse should be included in universal health coverage, that is the Sehat Card. I therefore set the House in Pakistan. Now, I will start first with defining some of the key terms used in the motion statement, starting off with what is a mental health disorder. It is a disorder which is characterized by significant disturbances in thinking, in emotional regulation, and in behavior. Drug addiction, on the other hand, is a disease that affects the brain and leads to an inability to control drug use. And for a treatment to be covered by the Sehat Card means for a patient to avail free healthcare service in a hospital preordained to be under the Sehat Card program. Now, the topics of how prevalent mental health disorders are in our society and the impact of such individuals in our society and the costs of healthcare for these patients will be explained by my deputy. I will start with my own arguments. My first line of argument, that mental health, like every other aspect of health, is a need, not a luxury. Let me start off by stating that it is a shame that I have to stand here and even debate this topic. Sehat Card refuses to include these patients, especially those injuries inflicted due to suicide attempts, in the Sehat Card because under the pretense that they are self-inflicted. I want to ask you, does Sehat Card refuse to cover the costs of coronary bypass surgeries by claiming that the patient should not have smoked in the first place? Does the Sehat Card program refuse to cover road traffic accidents by claiming that the driver should not have oversped? Are really type 2 diabetic patients returned by the hospital saying that they should have thought about it when they were gaining all that weight? No, I don't think so. Then why is this ostracization for mental health patients only? What use is your body if your mental clarity is eroded? Overuse of Sehat Card has made hospitals turn every normal obstetric case into a cesarean section. Every vague lower abdominal pain is treated by large interventional procedures like appendectomy without solid diagnosis. If Sehat Card has money for all this, then why is something as grave as a suicide attempt neglected? And please let me tell you, suicide isn't something that you attempt or you commit. Suicide is the last symptom of a disease called depression. My second line of argument, that addiction is a disease and thus should be treated like one. Now, this is a reiteration of the definition of addiction that I just shared with all of you. And that is because there was no valid definition out there that did not state addiction as a disease. Substance use disorder, opium dependence disease. Now, I already know that the opposition might say that drug abuse is some means of recreation, so its treatment should not be covered by the government. But let me tell you, regardless of whether it started as a means of recreation or to cope up with some sort of stress, when it becomes an addiction, that person is a patient that needs treatment. When I entered this college, I took an oath that I will alleviate all sufferings without bias and with openness of spirit. But where is this openness of spirit if I am refusing needy patients their treatments because the government reckons their suffering as self-inflicted or immoral? Are those drug addicts under these flyovers and bridges in completely disheveled conditions not citizens of the state? Are their families not taxpayers? Then why are they excluded from Sehat Card? My third line of argument is that exclusion of psychiatric patients from Sehat Card not only further aggravates this stigma that already exists in our society, that mental health disorders are not true medical disorders, Rather, it completely disregards psychiatry as an important field of medicine. When an individual, especially in impoverished circles, starts to face mental health problems, the first denial that they face is at home, where their family fails to empathize, where their family fails to understand, because of lack of awareness. But when such intellectual minds like health policy makers also completely neglect mental health patients, then this feeling of denial is greatly enhanced. The conclusion is that every reasoning that aligns with solid logic proves that yes, mental health patients that have suicidal thoughts or injuries due to suicide attempts, and those of drug abuse, yes, they should be included in Sehat Card coverage. Thank you.
Thank you, the proposition leader. Now, I'd like to call upon the leader of the opposition to refute the proposition's arguments and present their own line of arguments.
Bismillahirrahmanirrahim. Respected guests, honorable educators, esteemed proposition, ladies and gentlemen. Assalamu alaikum. I'm Khalid Afridi, and I will be the opposition leader of this House. The motion presented today was, this House believes that patients of mental health disorders, substance abuse, and suicide attempts should be included in universal health coverage, that is Sehat Card. Now, before starting my speech, let me tell you about my teammates. As the opposition leader, it is my job to challenge this motion, to give rebuttals to the respective opposition leader, and to present the opposition's line of arguments. The second speaker, my deputy, she will further develop our case, present rebuttals to the proposition, and elaborate our line of arguments. And the third speaker, the opposition whip, she will mainly focus on refuting the proposition and summarizing why the opposition side should prevail in this case. That being said, let me tell you how my speech will work. First of all, I'll comment on the leader of proposition speech. Then I will present my line of arguments, give an alternative approach, and finally I will conclude my speech. Now, the proposition leader, she did not define universal health coverage. This was a mistake she did. According to WHO, universal health coverage means that all people have access to the full range of quality health services they need when and where they need them without financial hardships. But WHO also adds, every country has a different path to achieving universal health coverage and to decide what to cover based on the needs of the population and the resources at hand. Now, the mistake of the proposition was that they haven't taken into consideration the resources of our country. And that being said, let me go ahead with my line of arguments. But before that, the topic was, should mental health be part of Sehat Card or not? She gave a very emotional speech as if we are against the patients of mental health. We are not against that, and I will give my alternate approach. There can be other solutions. We are saying mental health should not overwhelm the Sehat Card, because Sehat Card already is very effective and very efficient. If we include mental health in Sehat Card, it will spoil both the mental health part of Sehat Card and also what already was going on with it. My line of arguments first is financial and resource drain. In first world countries, universal health coverage is well established, it is well funded through taxes and mandatory insurance contributions. In second world countries, it is in a developing stage, and in third world countries, for most it remains a goal, not a reality. It is funded by external aids through government taxes, and it struggles with underfunding and with corruption. Universal health coverage core purpose is to include essential life-saving services to the broadest possible population. And by including treatments for mental health, we risk overburdening the Sehat Card system. These treatments, although they are important, they require long-term, sustained interventions like therapy, like counseling, like rehabilitation. and the ongoing nature of these treatments suggests that the cost of including them in Sehat Card would be exorbitant. My second line of argument is about the insufficient healthcare infrastructure. We must consider the systemic limitations of our healthcare system. It is not equipped to handle the inclusion of mental health in Sehat Card. The current system is already struggling, and the inclusion would result in the breakdown of both mental health services and broader healthcare system, affecting not just the patients with mental health problems, rather all those patients that rely on universal health coverage. Now my third line of argument is about personal responsibility, and I know the proposition will try to give rebuttals on this, but try to understand what I'm saying. While mental health disorders undoubtedly is a complex situation, it requires compassionate responses. Substance abuse, more often than not, it rises from personal decisions. Including its treatment could result in potential moral hazards, because individuals may feel accountable individuals may not feel accountable for their actions because the government will pay for their treatment. It leads to increase in risky behaviors because there is a safety net in place. A person, normally why doesn't he go towards drug abuse? Because he knows that there will be consequences. But if he knows that there are no consequences because the government is paying for my treatment, then he will be encouraged. Rather than discouraging substance abuse, this policy may unintentionally enable it by removing some of the natural consequences of their choices. The government should promote individual responsibility instead of covering the consequences of poor decision making of people and at the expense of the taxpayers. And my final line of argument is where I give some alternate approaches. We, the opposition, believe that the solution is not to overwhelm the Sehat Card. Instead, there should be a more targeted approach. The government should establish separate, specialized programs dedicated to mental health. The government can collaborate with private health insurance providers as well. Moving on, there can be another proactive approach. Instead of diverting the limited Sehat Card resources towards mental health, why don't we do something as if nipping the evil in the bud? Why don't we allocate this budget towards education and job opportunities? Because this will have two benefits. Number one, it will lead to a resilient society with greater literacy rates and better job opportunities. And number two, in such a society where people are more educated about taking care of their health, where people are having a respectful job, where people are having a happy and good family life, it will naturally lead to a decrease in mental health and substance abuse. And thus this will be like nipping the evil in the bud. In conclusion, honorable adjudicators, the opposition stands firmly against this motion. We believe that including mental health under Sehat Card would put unsustainable financial burden on the system. It will overwhelm the infrastructure. It will encourage irresponsible behavior without accountability. And we, the opposition, acknowledge the importance of addressing mental health, but the solution is not to overwhelm Sehat Card. Instead, targeted programs and partnerships can address these concerns in a more sustainable way. For these reasons, we urge you to reject this motion. Thank you.
Thank you, the leader of the opposition. And for the adjudicators' knowledge, the time of the speaker was 6 minutes and 36 seconds. Now, the proposition deputy will solidify the proposition stance even further. Please.
Ladies and gentlemen, esteemed judges and honorable members of this House, I, Sehat Card, am honored to speak before you as the proposition deputy. My sincere gratitude to the entire panel for affording me the privilege to speak. Ladies and gentlemen, our today's motion. This House believes that patients of mental health disorders, substance abuse and suicide attempts should be included in universal health coverage such as Sehat Card. As a deputy proposition, I'll be supporting this motion. My line of arguments will be in complete accordance with the definitions provided by my leader of proposition and also in accordance with the setting of the House, which the proposition leader set in Pakistan. My entire speech is divided into three parts. In the first part, I will be giving rebuttals to the leader of opposition. In my second part, I will provide constructive arguments of my side. And in the third and last part, I will be summarizing the entire core arguments of my speech. Starting with the rebuttals of the leader of opposition. The leader of opposition claimed that it will cause adding of mental health patients, substance abusers and suicidal attemptees. This will cause resource strain and overburden the budget as they are expensive. Yes, they are expensive. And what do you think? By ignoring them, you will be just by ignoring these expensive treatment, you will be costing them 10 times more. Ladies and gentlemen, mental illnesses are correlated with health disorders. For example, anxiety and depression, they lead to cardiovascular diseases, diabetes and hypertension, which are 10 to 20 times more costly than the treatment of mental health disorders. So be prepared to watch your resources bleed when you will be giving your mental health, your physical health problems more edge. When these untreated mental illnesses turn into physical health crises, you will watch your budget go bleed more and more. Turning to my line of arguments, my first line of argument is drastic increase in patients suffering from mental health problems. Your Honor, mental health disorders, abuse of drugs and suicide attempts are escalating at an alarming rate in Pakistan. The opposition needs not to worry because I have statistics and reports to back my words. According to World Health Organization, approximately 24 million people in Pakistan are in dire need of mental health care. And not just mental health care, ladies and gentlemen. Suicide attempts have also seen a notable rise. According to World Health Organization, suicide mortality rates in Pakistan have increased from 7.5 per lakh in 2010 to 8.9 per lakh in 2020. Now keep in mind, suicide attempts are different from the suicide actual rates, because the suicide attempts are 10 to 20 times higher than the suicide rates. So technically, suicide attempts have 3 figures per annum. And we also know that most of the cases go unreported because of the social stigmas. And let's not forget the substance abuse. According to Anti-Narcotics Force, number of drug abusers in Pakistan have grown from 6.7 million in 2013 to 7.6 million in 2021, a big reason to worry and the shame on opposition. Your Honor, we are not talking about hundreds or thousands. We are talking about millions of patients. By excluding them from universal health coverage like Sehat Card, we are depriving millions of patients from the healthcare services that they actually deserve. My second line of argument is financial burden of treatment. Your Honor, for the treatment of patients that suffer from mental health disorders and suicidal tendencies, the cost of seeing a psychiatrist, hospitalization, medication and therapy are quite expensive. And let's not forget the treatment of substance abusers. They require rehabilitations, detoxification programs, counselings and follow-up therapies that cost around 1.3 lakhs to 5.4 lakhs. And here comes the interesting part, ladies and gentlemen. Majority of these patients belong to impoverished and poor communities. Let's have a look at some surveys. According to UNODC report, 80% of the drug abusers in Pakistan cannot get access to rehabilitation services due to financial difficulties. I repeat, due to financial difficulties. According to Pakistan Mental Health Survey, 60%, I repeat 60% of the patients of mental health disorders cannot get any form of treatment due to, again, financial burden. Now, ladies and gentlemen, let me remind you of the fundamental reason behind the establishment of Sehat Card program. Sehat Card program was introduced to help the low income and poor people get access to important healthcare services without worrying about high medical costs. So keeping in view the Sehat Card program's original mandate, we need to include these patients in Sehat Card scheme, as majority of these patients live below the poverty line and cannot get access to any form of medical treatment. My third line of argument, socio-economic impact. Your Honor, these mentally ill patients consume substances and engage in various criminal behaviors such as thefts, violence, and even killings. This creates unrest and tension in the society. And along with that, these individuals negatively impact the work environment due to low productivity and decreased performance. So in short, the overall well-being of the community erodes and leads to fragmented social structure with hampered economic growth. Ladies and gentlemen, my last part of debate, I present before you the summary of the core arguments made by my bench. Excluding these disorders from Sehat Card will further aggravate the stigmas associated with mental health disorders. Treatment of these mental health disorders is as much important as that of physical health disorders. These patients are getting engaged in various criminal activities in the society and also hampering the economic growth. Since there is a rise in number of these patients and also majority of them cannot afford treatments due to high costs, so inclusion of these patients in universal health coverage like Sehat Card is our need, not a luxury. Please, I would like to request the jury to please pass this motion. With this, I rest my case. Thank you.
Thank you, the proposition deputy. For the adjudicator's knowledge, the time of the speaker was 7 minutes and 16 seconds. Now, the opposition deputy will further strengthen the opposition's case with critical counter-arguments.
Greetings and welcome to faculty and respected proposition. Thank you, Honorable Chair, respected Dean, Head of Department of Psychiatry, Dr. Imran, and CEO Sehat Card, Dr. Muhammad Riaz, for taking out time from their busy schedule and letting us this opportunity to discuss a critical motion. Myself, Ikra Khaksar, and I am Deputy Opposition Leader of this House. This House believes that patients of mental health, substance abuse, and suicide attempts should be included in universal health coverage, that is Sehat Card. While I acknowledge the importance of addressing mental health disorders, substance abuse, and suicide attempts, I strongly oppose including these conditions in universal health coverage. The structure of my speech would be, I'll be making rebuttals to proposition, then I'll be giving my line of arguments, and finally I'll be concluding my speech. Our opposition leader has clearly mentioned what UNC covers in first world country and a third world country. The proposition leader made a very emotional speech, but we are being very critical and practical. Proposition leader mentioned citizen has equal rights for the treatment, and then the deputy opposition leader made a rebuttal to opposition leader saying that the mental health is costly. We haven't said that mental health is costly, rather we simply oppose adding its treatment to Sehat Card, so not to overwhelm, instead specify focused initiatives. Extending the speech of my opposition leader, my first LO is, ladies and gentlemen, the cost of treating mental health disorders and substance abuse is substantial, but including these conditions in Sehat Card would divert resources away from other emergencies, and in a third world country where healthcare infrastructure is very, we cannot afford to compromise existing services. To support my argument, I have an example. A report by the National Institute on Drug Abuse estimated that the substance abuse treatment cost the US healthcare system approximately $114 billion annually. My second line of argument is resource allocation. Prioritizing mental health disorders and substance abuse might compromise the quality of care for other critical health issues. We must prioritize, effectively ensuring that our limited resources are allocated effectively. A study published in the Journal of Substance Abuse Treatment found that providing universal health coverage to individuals with substance use disorders increased healthcare utilization and cost without significant improvement in treatment outcomes. My third LO is misuse of resources. Providing Sehat Card for mental health disorders and substance abuse may accidentally perpetuate stigma. By these conditions, we risk encourage misuse of resources as some individuals may exploit the system for personal gain. A study in the Journal of Clinical Psychology found that offering free healthcare to drug abusers might incent harmful behavior rather than encouraging rehabilitation. My fourth LO is lack of personal responsibility. As already discussed by the opposition leader, I am going to elaborate this LOA. Offering free healthcare without accountability may not promote proactive health management. A study in the Journal of Addiction Medicine found that individuals with substance use disorders who received free treatment had lower rates of long-term recovery compared to those who paid for the treatment. My last LO is misallocation of health priorities that would result from this motion. Mental health and substance abuse, while serious, often do not pose the same immediate risk to life as conditions like cancer, cardiovascular diseases, and infectious diseases. Sehat Card was designed to tackle the most pressing life-threatening issues that affect the population at large. In a resource-limited system, the inclusion of mental health conditions could dilute the effectiveness of Sehat Card. This means that the patient with acute, life-threatening conditions may find their access to care compromised because funds are being redirected to long-term treatments for conditions that don't pose an immediate danger to life. Opposition leader has already mentioned alternate approach to mental health disorders by PPPs, that is public-private partnerships. Public-private partnerships can expand mental health services to underserved population. Private sector expertise can enhance service quality and efficiency. It can attract additional funding for mental health initiatives. Some of the examples are the Global Alliance for Mental Health, WHO, private and government organizations to improve mental health services. In conclusion, while our hearts go out to those struggling, we must prioritize effective, efficient, and responsible healthcare solutions. Let's focus on community support, public-private partnerships, targeted interventions that include CBTs, DBTs, rather than including it in Sehat Card. Sehat Card that may enable harmful behaviors. For these reasons, we urge the House to reject this motion. Thank you.
Thank you, the opposition deputy. And for the knowledge of the adjudicators, the time of the speaker was 5 minutes and 45 seconds. Now, to further solidify the proposition's stance, we have the proposition whip, please.
Hello, Assalamu alaikum. My name is Muhammad Taha Shuaib from third year and I will be the whip of the government for today. First of all, I'd like to give some apologies to the judges that my speech will not be up to the mark because I was not feeling very well yesterday. So most of the things I'll be saying will be impromptu. I have not prepared very well. I'd like to thank you, Dr. Muhammad Riaz, for giving us the time to speak on this topic. So my speech will be basically divided into two parts. पहले पार्ट में मैं this speech will be bilingual, so I'll be switching between English and Urdu. अच्छा, my speech will be divided into two parts. पहले पार्ट में मैं कुछ रिबटल्स देना चाहूँगा हमारी ऑपोजिशन को. सबसे पहले जो हमारे लीडर ऑफ ऑपोजिशन है वो कहते हैं कि جو آپ کی مینٹل ہیلتھ ایشوز ہے اس کے لیے لانگ ٹرم آپ کو ٹریٹمنٹ چاہیے. آئی تھنک دس از ناٹ اے ویلڈ آرگیومنٹ ایٹ آل, کیونکہ زیادہ تر میڈیکل ایشوز کے لیے لانگ ٹرم ٹریٹمنٹ نہیں چاہیے ہوتی ہے. کیا ڈائبٹیز کے لیے لانگ ٹرم ٹریٹمنٹ نہیں چاہیے, یا کیا سی وی ایس ایشوز کے لیے لانگ ٹرم ٹریٹمنٹ نہیں چاہیے. So this is not a valid argument to exclude psychiatric illnesses from Sehat Card. اچھا, پھر وہ کہتے ہیں کہ دس از اے پرسنل چوائس, کہ یہ اس کی اپنی مرضی تھی کہ وہ ڈرگ ایڈکٹ بن گیا. لیکن آئی لائک ٹو سے کہ یوزولی people start taking drugs due to some societal pressure, دوستوں کے پریشر اس طرح سے, لیکن after that they do not have the choice. وہ اس قدر ایڈکٹ ہو جاتے ہیں, ان کی برین کی سرکٹری اس طرح چینج ہو جاتی ہے کہ they cannot resist not taking the drugs. So if you want personal accountability to be there, تو صرف ڈرگ ایڈکشن کو personal accountability کی بیس نہیں ہونا چاہیے. اس کے علاوہ جو لوگ ایکسرسائز نہیں کرتے, جو لوگ فیٹی فوڈس کھاتے ہیں, جب وہ اوبیز ہو کے آپ کے اسپتالوں میں پڑے ہوتے ہیں, آپ کے صحت کارڈ کے, آپ کے ٹیکس پیئر کے پیسوں سے ان کا علاج ہوتا ہے, تو کیا آپ ان سے کہتے ہیں کہ نہیں آپ کی پرسنل اکاؤنٹیبلٹی ہونی چاہیے, that why did you eat so much. اچھا, پھر وہ کہتے ہیں کہ ریہیبلیٹیشن جو ہے that is not worth doing financially. لیکن اس کے علاوہ میں یہ آرگومنٹ پیش کرنا چاہوں گا that short term میں تو ریہیبلیٹیشن کی کاسٹ ہائی ہے اپ فرنٹ, لیکن لانگ ٹرم میں اٹ از اے ویری گڈ انویسٹمنٹ. ریزن یہ ہے کہ اگر آپ ایک بندے کو ریہیبلیٹیٹ کرتے ہیں, سو یو آر برنگنگ اے پروڈکٹیو ممبر آف دا سوسائٹی بیک انٹو دا ورک فورس. لیکن صرف وہ اکیلے نہیں, اس کی فیملی بھی اس پہ ڈیپینڈنٹ ہوتی ہے. سو بائی ریہیبلیٹیٹنگ ہم یو آر ناٹ اونلی ہیلپنگ ہم بٹ آلسو ہز فیملی. دوسری چیز یہ ہے کہ جب وہ ڈرگ ایڈکٹ آ کے, اس کو لیور کے پرابلم ہوں گے, اس کو ہارٹ کے ایشوز ہوں گے, جب وہ آ کے آپ کے اسپتالوں میں پڑا ہوگا, تو کیا تب اس پہ صحت کارڈ کے پیسے نہیں لگیں گے, which is more than. دوسری بات یہ ہے کہ جو ڈرگ ایڈکٹس ہوتے ہیں, they have a higher incidence of HIV and hepatitis, which for your information is not treatable at all. تو اگر اس ڈرگ ایڈکٹ سے ایک اور بندے کو بھی HIV لگ گیا, so I think that would completely cancel out the cost of the rehabilitation. تیسری بات, تو ہمارے ڈرگ ایڈکٹس جو ہیں وہ کرائمس کرتے ہیں. جو لوگ حیدرآباد میں رہتے ہیں ان کو پتہ ہی ہوگا کہ مارکیٹس آر فلڈ ود دیز پیپل. تو ان کے جو کرائمس ہوتے ہیں, آر دیز ناٹ اکاؤنٹڈ انٹو دا فائنینشیل سچویشن. صحت کارڈ کوئی الگ سی چیز تو نہیں ہے, یہ تو حکومت کے بجٹ میں سے اس کا حصہ ہے. تو جو چیز اوور آل حکومت کو افیکٹ کرے گی وہی صحت کارڈ کو بھی افیکٹ کرے گی. اچھا, پھر ڈیپٹی لیڈر آف اپوزیشن کہتی ہیں کہ سائیکیٹرک النیسز سے جو ریسورسز ہیں وہ زیادہ امپورٹنٹ چیزوں سے ڈائیورٹ ہو رہے ہیں. سو آئی لائک ٹو سے کہ ہماری کنٹری میں بہت سی ایسی یوز لیس چیزیں ہیں جو حکومت پرووائڈ کرتی ہے کچھ لوگوں کو, جس سے ریسورسز ڈائیورٹ کر کے سائیکیٹرک النیسز کو دیے جا سکتے ہیں. وائی از اٹ بینگ ایکسکلوڈیڈ جسٹ فار دس ریزن. اچھا, ایک اور بات یہ کہ جو ٹریٹمنٹ آپ نے یہ آرگومنٹ پیش کیا کہ اگر ہم ڈرگ ابیوز ایڈکٹس کو صحت کارڈ کی حکومت کے پیسوں پہ ٹریٹ کریں گے تو اس سے اس کو انکریجمنٹ ملے گی کہ وہ فردر کرے. آئی تھنک دس از اے ویری ڈم آرگومنٹ. کون ڈرگ ایڈکٹ بننا چاہے گا اگر مجھے پتہ بھی ہوگا کہ میری فری ٹریٹمنٹ ہوگی؟ who would like to do it? اچھا, اگر ہم فائنینشیل ایسپیکٹ کو دیکھیں تو سائیکیٹرک ایشوز جو ہیں وہ حکومت کے فائنینشیل ایسپیکٹ پہ بہت زیادہ اثر انداز ہوتی ہے. اکارڈنگ ٹو دی امریکن انسٹیٹیوٹ آف مینٹل ہیلتھ ایشوز, ورلڈ وائڈ 12 بلین ورکنگ پروڈکٹیو ڈیز جو ہیں وہ ویسٹ ہوتے ہیں بیکاز آف ڈپریشن اینڈ اینزائٹی. تو اگر اس سے پوری کنٹری کے پورے بجٹ پہ اثر پڑے گا, which eventually will affect صحت کارڈ as well. So it is not a standard, صحت کارڈ کوئی اسٹینڈ الون چیز نہیں ہے, یہ پوری حکومت کے بجٹ کا ایشو ہے. باقی یہ کہ جو لوگ مینٹل ہیلتھ کے ایشوز کے ساتھ فیس کرتے ہیں ان کے وہ اتنے پروڈکٹیو نہیں ہوتے. جب وہ پروڈکٹیو نہیں ہوں گے تو ٹیکس کون بھرے گا؟ جب ٹیکس نہیں بھریں گے حکومت کا بجٹ کم ہوگا, ایونچولی صحت کارڈ کا بجٹ بھی کم ہوگا. سو آئی تھنک اگر ہم بجٹ کی ایشو کو ہم نے کلیئر کر دیا, which is probably the main issue کہ psychiatric illnesses کو اس میں انکلوڈ نہیں کیا گیا ہے, تو if budget is not the issue if stigma is not the issue, since we are doctors and we know that mental health is a real thing. So अगर budget issue नहीं है, stigma issue नहीं है, so what is the issue? I don't see any reason to exclude psychiatric illnesses from the Sehat Card. So I'd like to ask Dr. Reyes Tanuli said that you have seen our arguments and I think they are very convincing that indeed psychiatric illnesses should be included in the Sehat Card. Thank you very much.
Incredible speech, proposition made. And for the knowledge of the adjudicators, the time of the speaker was 6 minutes and 14 seconds. Now, to further solidify the opposition stance, we have the opposition's rep. Please.
Bismillahirrahmanirrahim. Assalamu alaikum, Honorable Chair, respected judiciary, esteemed proposition, and distinguished guests. Assalamu alaikum again. I am Nala Arshad, the opposition whip for today's debate, which is being presented on the motion that this House believes that patients of mental health disorder, substance abuse, and suicidal attempts should be included in universal health coverage, i.e. that is the Sehat Card. As the House is being said in Pakistan, my arguments will mainly focus on the inclusion or the exclusion in the Sehat Card. Being the opposition whip, I'll first present the structure of my debate. I'll begin by presenting rebuttals to the opposition leader, the opposition deputy, and their whip. I'll then present rebuttals that they presented on our arguments. In last, I'll present a summary and will try to pursue the judiciary as to why our stance on this issue is more superior than that of the esteemed proposition. First of all, I'll begin. The proposition leader mentioned that Sehat Card excludes patients of mental health disorder. That's because they think that these disorders are self-inflicted and we do not need to treat a self-inflicted disease or thing. That's not quite true. Actually, the Sehat Card would extend their deepest medical coverage to the patients, even if that is self-inflicted. But actually, the relapse rate in mental health patients is extremely high. You treat the problem without cutting the root. That is, you treat a patient who's undergoing depression, has suicidal thoughts, you give him a psychotherapy, you send him to the universal health coverage, that is, you treat it on the Sehat Card. What are the chances that his family, his economic, social status won't drive him to these means again? I mean, the relapse rate is quite high, and that actually stains the economy as well. Actually, now there's a patient of diabetes. We treat him, even though the treatment is long term. We expect fruitful results with 0 or 0.2% of a relapse rate. But a patient of mental health, as long as his family history, his economic burden, unemployment aren't treated, you cannot expect him to recover fully. You cannot expect him to become a worthy, valuable member of the society. So you have to remove the root before presenting the Second, the proposition leader said that suicides aren't treated by the Sehat Card. I'm right, that was the line of argument, right? So, suicide is actually not linked to mental health coverage or by the universal health coverage Sehat Card. For suicide, you have to look into the person's socio-economic history. What drove him into those harsh, drastic measures? Like, why did he opt to do so? And what are the chances he won't do so even after receiving the therapy, the Sehat Card treatment? What are the chances he won't resort back to the suicidal means? That I'd like the judiciary to focus on this. Then there was that with the exclusion of mental health patients from Sehat Card, we are going to promote social stigma, right? I mean, we are removing mental health section patients who suffer from mental health diseases. from Sehat Card that's going to promote social stigma. Like people are going to say we aren't focusing on them much. That's not true. Social stigma is actually from the patient's family side. They actually try to abandon the patient. They actually do not even present the patient illness at time. Early intervention can be treated, it can reduce economic burdens, but the families of the patient actually do not like to share their patient's mental health illnesses with the other members of the society, making it difficult for the Sehat Card, making it difficult for other health insurance agencies to treat them. And by the time they are exposed, they have reached a stage where long-term therapy is required and where the resources then stay in the economy very much. The deputy speaker of the proposition said that there is a drastic increase in mental health patients, and that's because we are not treating them, and that this increase is now going to bleed our economy, right? This was your line of argument. So I'm going to say, do you think the rise in the patient is just because we are not giving them the Sehat Card facility, or is it just because that in this country, the burden, the unemployment rate, the poverty, that's driving them to these measures? Do you not agree that the rise in the number of these patients is due to
POI.
You cannot ask the POI of it.
We can.
You take it. You said so that these figures bring shame to the opposition. You mentioned some figures, you said these are the shame on the arguments of the opposition, right? Well, I'll say that our esteemed proposition leader said the alternative solution is to educate the society. You educate the society, you provide employment opportunities, and boom, you have the rate go down to the bottom of the graph. Is that not right? So instead of treating them, making them dependent on the Sehat Card, encouraging their acts, encouraging their relapse rate, you're actually encouraging them. And we do not say that we are excluding their treatment. We just don't want them to include in the Sehat Card. We have provided alternatives. We should have a public-private negotiation, NGOs run by public-private sector incorporation. This can greatly reduce the economic burden. Okay. Then we have the cost of treatment, right? We said that the cost of treatment is very much. They said if you do not provide the timely treatment, it's just going to bleed your economic resources more. So I've already said early intervention is not possible in these cases due to their society stigma, due to their families who feel shame in exposing them to the society. Okay? Then we had the whip. He said that अगर आप लोगों ने, sorry I'm using bilingual, अगर आप लोगों ने कार्डियोवैस्कुलर डिजीजेस वगैरह ट्रीट नहीं की, यानी इनको ट्रीट नहीं किया, सो ये आपके पास सोसाइटी के वर्दी मेंबर्स नहीं बन सकते और प्रोडक्टिविटी कम होगी, टैक्स कलेक्शन कम होगी। आप मुझे बताएं, एक हीमोडायलिसिस का पेशेंट है, वो आपके पास सोसाइटी का एक प्रोडक्टिव मेंबर है, will he be able to pay the taxes? So this kind of balances our argument, don't you think so? In the end, I'll summarize our points of argument. We are in opposition to this motion because it is staining the society, economic resources. We have provided the alternate solutions to these problems, and we, being the opposition, will ask the respected judiciary to please oppose the stance of this motion. Thank you.
Thank you, the opposition whip. For the dedicated knowledge, the time of the speaker was 7 minutes and 54 seconds. Now, we'll have two reply speeches, one from each of the bench. Let me state the boundaries for the reply speeches once again. The reply speech will be 4 minutes long, the limit will be 4 minutes, and it will be a conclusive speech. They will conclude their side's arguments, and please avoid rebuttals in this, and no POIs can be asked in this. So, first of all, I'd like to call the opposition reply speech. Please.
British
हुआ था तो इसलिए मैं अभी उर्दू में बोलूँगा। हमें जब ये मेरी आवाज़ आ रही है? स्टॉप बस। हमें जब ये टॉपिक दिया था तो जो भी पूछ रहे थे कि खालिद क्या टॉपिक मिले, एंड वी सेड दैट वी हैव टू अपोज मेंटल हेल्थ शुड नॉट बी इंक्लूडेड इन सेहत कार्ड, और फिर सारे कह रहे थे कि ये किस तरह अपोज करोगे। लेकिन इसी तरह हुआ कि जो हमारे प्रोपोजिशन वाले थे उनके ज़्यादा स्पीचेस इमोशंस पे मबनी थे। जो पहले स्पीकर थे उन्होंने भी सही सियासतदानों की तरह सही इमोशनल स्पीच किया। दूसरे स्पीकर उनका थोड़ा सा ChatGPT बेस्ड था, बिल्कुल बोरिंग था, और तीसरी स्पीकर ने क्रिटिकल थिंकिंग की, मैं इतना कह सकता हूँ। तो I don't know for where should I start. Let me say that there are three things that came in my mind. There is a primary health issue, then this includes like cough, sneeze, temperature for example. Then there are those major health issues like TB, breast cancer, surgeries, etc. Those expensive things, they need treatment. And then there are mental health issues. Now, we are not saying that these other issues don't exist, the primary health issues don't exist, or the mental health issues don't exist. Of course we are not saying that. We are saying that these should not be included in Sehat Card. Sehat Card is, because Sehat Card will be overwhelmed. We don't want to spoil the efficacy and the effectiveness of Sehat Card. And that is why the CEO, most probably he hasn't included it till now. That's the reason. And we weren't supposed to say rebuttals. Can I say? I can just comment on some of their points. He said that I said that these are costly and that's why we should not take care of mental health. I never said they're costly. I gave two alternate solutions. I said that instead of treating mental health within Sehat Card, why don't you have some specialized, focused initiatives with public-private partnerships for mental health treatments? I didn't say, even over there, the budget will be allocated. But I'm not saying, I'm just saying, don't bring this within Sehat Card. The second alternative approach was the way our whip spoke, that if someone is depressed, there is a reason behind it. Let's say, for example, I'm depressed because I'm not having a job. And then I go and they treat me with the taxpayers' money. And then again I come back home, but I'm again not having a job, so again I get depressed. So the point is that let me say my four-line argument because there's less time. My first line of argument was financial reasons. I said that we're living in a third world country. This isn't a first world country. Over here, this Sehat Card, it's a good initiative, but let's go step by step. हम of course चाहेंगे कि mental health को हम solve करें, लेकिन step by step आगे जाएं. फिलहाल जितना हमारे पास resources हैं, हम उस पे इतना कर लेते हैं कि जो major surgeries वगैरह हैं उनकी treatment हम करते हैं उस पे. दूसरा ये मैंने कहा था कि हमारा इंफ्रास्ट्रक्चर सेहत कार्ड का खराब हो जाएगा अगर हम उसमें मेंटल हेल्थ शामिल कर दें. और इसमें एक और चीज़ भी था, मैंने इससे पहले नहीं कहा था कि देयर इज अ रिस्क ऑफ फेकिंग इट. मैं जाऊंगा और मैं बोलूंगा कि आज मैं बहुत ज़्यादा नाराज़ हूँ, तो आप लोग ना मुझे ट्रीटमेंट करें, मुझे जो भी चीज़ हो. और क्योंकि मैं घर में पैसे फारिग बैठा हुआ इसलिए मेरा जॉब नहीं है, तो मैं चला जाता हूँ उधर. फिर वो ट्रीटमेंट कर लेंगे, मुल्क के पैसे इस्तेमाल होंगे, आप लोगों की टैक्सेस के पैसे होंगे, मैं घर आ जाऊँगा, दोबारा चला जाऊँगा उधर, क्योंकि मैं तो फारिग बैठा हूँ. ये चीज़ होता जाएगा. तीसरा मैंने कहा था पर्सनल रिस्पॉन्सिबिलिटी का. पर्सनल रिस्पॉन्सिबिलिटी ये था कि उन्होंने कहा था कि कौन चाहेगा कि वो ड्रग अब्यूज में जाए. तो इसमें ये है कि जो बंदा पहली दफ़ा ड्रग अब्यूज में गया, लेट्स से मैं हूँ और मैंने ड्रग अब्यूज कभी नहीं किया, और मुझे पता है कि अगर मैं करूँगा उसके कॉन्सिक्वेंसेस होंगे, ठीक है, लेकिन फिर भी मैंने ये चीज़ स्टार्ट कर ली है. अभी जब मुझे मेरे जहन में ये भी है कि मैं अगर कर भी लूँ लेकिन कोई कॉन्सिक्वेंस इसलिए नहीं है क्योंकि सोसाइटी ने दुखाया कि कोई स्टिग्मा भी नहीं है, दूसरी तरफ मुझे गवर्नमेंट से टैक्स पेयर्स के पैसों से मेरी ट्रीटमेंट भी हो रही है, तो चलो उसमें किस्मत आजमाई कर लेता हूँ. 2-3 साल मैं और फिर मैं वापस मैं रिटेक हो जाऊँगा तो बहुत अच्छी बात है. उन्होंने कहा था कि डायबिटीज़ की ट्रीटमेंट या कुछ इस तरह कह रहे थे. देखिए जो मेजर हेल्थ इश्यूज हैं उनमें रिलैप्स कितना होता है, बहुत कम होता है. मेंटल हेल्थ इश्यूज में बहुत ज़्यादा रिलैप्स होता है. एक बंदा एक पेशेंट है मेंटल हेल्थ का, बस वो रहेगा, नहीं कहना चाहिए, वो सही हो भी जाएगा लेकिन उसमें रिलैप्स बहुत ज़्यादा है. सॉरी. So I guess my time is up.
Thank you, Your Honor. For the dedicated knowledge, the time was 4 minutes and 31 seconds. And now we'll have the last speaker of today's session, the proposition reply speaker. Please.
Those will actually stand. Gentlemen, in this reply speech, I'll provide the core summary of my bench. Ladies and gentlemen, mental health disorders, substance abuse, and suicide attempts are increasing at a rapid rate in Pakistan. The Sehat Card, designed to provide universal health coverage, predominantly focuses on providing free healthcare services to the patients suffering from physical health disorders and pays little to no attention to patients who are suffering from mental health disorders, substance abuse, and suicide attempts. Your Honor, mental health disorders, substance abuse, and suicide attempts are legitimate medical conditions as stated by World Health Organization. These disorders affect our quality of life and our well-being in the same manner as the physical health disorders. So they must not be discriminated and should be included in the Sehat Card services just like the other physical health disorders. Excluding these vulnerable groups from Sehat Card services significantly worsens the stigma surrounding the mental health. By not providing coverage for these groups, society perceives mental health disorders not as important as physical health disorders, and this will stop individuals from seeking mental health treatments. And ladies and gentlemen, a social change is driven by policy, and this initiative can help us to reduce the stigma. The number of patients suffering from these critical conditions are not in hundreds and thousands, but in millions. Millions of patients suffering from mental health disorders, suicidal tendencies. Millions of patients who abuse substances and drugs. Millions of people who belong to impoverished communities and who cannot afford costly treatments. And considering the main purpose of Sehat Card, again, whose aim was to provide healthcare services to the poor and low-income patients free of cost, these millions of impoverished people should be included among the Sehat Card beneficiaries. If we do not provide them the free healthcare services that they actually deserve, their number will be keeping on increasing. They will continue to hinder the social well-being, order, and infrastructure. Also, they will hamper the economic growth and bringing more financial disparity. Your Honor, this debate is not about budgets, threats of misuse, and resources drain. This debate is about human lives. Human lives that are enduring unimaginable sufferings, stress, and pain. Human lives who day after day face internal battles that many of us will never fully comprehend. All they are asking for is a chance to heal, rebuild, and contribute to the society. By denying them access to free healthcare services simply gives a message that their mental health doesn't matter. Their struggles are insignificant. Their struggles are basically insignificant, and their lives, ladies and gentlemen, are worthless. That's what we are giving the message to them. But ladies and gentlemen, we must acknowledge that every life holds an inherent value, a purpose, a potential. Every life matters. Every life counts. By including these patients among the beneficiaries of Sehat Card, we affirm their right to health and wellness. We offer them the chance to reclaim their lives and contribute positively to this society. With this, I trust my case. And also, you cannot give rebuttals in the reply speech.
Okay, thank you, the opposition reply speaker. And for the adjudicator, the time of the speaker was 4 minutes and 9 seconds.